Hi, everyone. Welcome. Today is my fifth or sixth episode. I can't even remember. I can't even keep track of my podcast episodes anymore. So, very excited today because I've got a very special guest with me. I know I keep saying this all the time, but today it really is very, very special because I have Dr. Maya joining us today. Dr. Maya Rathore, welcome and thank you so much for joining us. Hello.
Thank you so much for inviting me. It's immense pleasure to join you guys.
Just to give you guys a little bit of introduction, Dr. Maya is a gynecologist, obstetrician, and also a bodybuilder. So when I posted on my Instagram that I'm looking for someone who is an IVF specialist, sorry, I forgot to completely mention that you're also an IVF specialist over here and very actively part of the research side of the things. Um, People started tagging me with your profile and they were like, Mariam, you need to get in touch with Dr. Maya, not only because she's an IVF specialist and a pro in this field, but also she's a bodybuilder. I'm like, really? How did she find all this time to work out and build all this muscle? So before we get into the podcast and before we get into the topic, I want to know, how long have you been training for and what got you into bodybuilding?
I have been training from less than 10 years, and after my kids, I was overweight. And before my marriage, I was a super active woman with lots of medals in my college activities and all. But then, as being a doctor, I was putting a lot of weight and I was not able to work out. And then after becoming 86 kg, after my
Wow.
second baby, I
Yes.
decided to go back. And during that journey, I met my friends, and then those keep motivated me. And then later on, finally, it was a time when I decided to compete and get back on stage and be super active woman again.
Oh my God. So, Dr. Maya, people say that once you've given birth, right, you can never go back to
Yeah.
your, like, pre-baby body state and you can never have abs. Okay, maybe you can have abs, but it is so difficult. How difficult it is because you're a mom, not just that you've given birth to two kids,
Yeah.
but also you're working full time and you're a mummy, you're a working woman. How difficult it is. Do you think other women can also achieve this?
Absolutely. It's all totally on your determination. As I said, when I was 86 and when I started my journey, when I was on stage for the first time, I was 53 kgs. And of course, it is a bit hard because you have responsibilities of your kids and your family to take care of. Of that, you have to take time for what you are aiming to come back on your shapes. But yes, when you ask me, is it not possible? It is definitely a possible thing where you
Is
can be
definitely
before.
yes.
Yes, it
So, Dr.
is.
Maria, when you're competing, right, and you've got like special diet, you've got this special diet, what happens to the family?
Yeah.
Like your kids, your husband, do they also help you with, like, do they also eat the same food or how does that work?
No, that is completely different on the diet which we have. That is completely of the all the spices we add on. That's completely different, where we have to be very specific with the weight of what we are eating and the proportion of carb, protein, what we are eating. So that's totally different from what a routine family will have their food.
Beautiful. Guys, I completely forgot to let you know, but she's also won two titles over here. She recently in 2021 championship, she was novice figure. She won the competition, right? You came first,
Yeah.
and also you
Yes.
placed third in open championship.
Yes.
So were you proud of yourself? Like I looked at your profile and I felt proud. I was like, oh my God, I'm just really proud of this woman doing all of these things like superwoman. How did that make you feel, especially when you're doing it over here in a country that is, I don't want to say it's not yours, it is your country, but it's still foreign land.
Yes, initially it was, I am a bit kind of introvert. And when
Okay.
I went there, I had never worn bikinis, high heels, and this was totally out of my track. And I was scared, like, I am from India. How I'll be meeting people, how will they accept me? But to my amazing, it was absolutely a different story. They taught me everything. They taught the confidence in me, I have to be on stage. Everything was different, and they helped me tremendously. Without them, I wouldn't have been a part to be competing and being that confident to win that.
Yes.
And also that I was very short in stature, so I have a small
Oh, okay.
height, and the women here are genetically have a good height. So I
Yes.
used to be very scared, like I am nowhere looking on the stage. How will I
Yeah.
do that? But then, yes, with the confidence and with the motivation of doing something in life, made me stand there.
That's beautiful. And look, I'll also just quickly share my journey on this. When I first competed as a power lifter and I was all over media, I remember I freaked out because a reporter took my video from Instagram and just it was circulating all over TV channels, all different TV channels. And I freaked out. I was like, oh my God, I'm wearing such a small suit. How everyone back home is going to react. But people really encouraged me and people really encouraged me to compete again. So that was pretty shocking. I didn't expect that, but yes, that did happen to me as well. All right. So let's get into our topic. The topic for today is that we want to talk about fertility in 30s. Women who touch 30s, who hit 30s. It is believed, especially in our culture, that it is super, super hard. And also,
Yeah.
look, I feel personally that it is believed in the entire world that once you hit 30s, that's it, you're good for nothing. You might as well just give up on getting married and all of those things, right? Like you're of no good.
Yeah.
So this is what I want to talk about. And look, at the end of the day, I want the moral of the story. I want moral of the story to be so that women are not discouraged. Women are not sad that they're turning 30s. I'm 33, and when I turned 30, it was such a beautiful phase of my life, whether it was financially, career wise. It takes time, and you're a lot more mature as well. You'd like to think so.
Yeah.
And I'm sure many people disagree with me. Okay, anyway. So, yes. So, what I want to start with is, do you think that there is a biological clock for women, first of all? Do you think there is any such thing as called as a biological clock?
Yeah, that biological clock is the pressure a woman feels to get pregnant in the reproductive age. Yes, definitely there is a decline in the fertility rate after your mids of 30s. So yes, it does has impact on the women's, that there is a biological clock where we have to accept it.
Okay, so there is a biological clock, and look, I also have always believed in it that yes, there is a biological clock, and I always think and have said to myself that look, if I can't, I haven't even found a partner yet. But let's say if I am, and I'm 33, so let's say down the track, 2 3 years down the track, I find someone, and then you're getting to know each other, blah blah blah, whatever. By the time you get married and you end up having kids, God knows how old I would be. So should I just give up on this hope that I'll be able to conceive?
No, no, it's nothing like that. See, having a baby at a certain age, there is no age for anyone to have a baby, frankly speaking. You have to consider the only thing is in this biological clock, there is a percentage of you becoming pregnancy declines. And it is not
Okay.
a rapid process, it is a
Okay.
long, sustained process till you become a menopause. But
Yes.
yes, the chances of you decline, but there is not no to it.
Yeah.
Definitely not no.
So first of all, there is a biological clock. Now,
Yeah.
what is the ideal age for women to have kids?
Um, See, as I said, there is no ideal age for everyone to have a baby.
Yes.
But as considered medically, we think that fertility is more from 20s to mid of 30s.
Mid of
After
30s.
35 to 40, yeah, mid of 30s, like after 35 to 45, there are chances that you have like around 30-40% chance that you get pregnant every month. And from 45, there is 5% chance that you become pregnant every month. But when you ask an age, that's not the
Yes.
only age which you have to consider when you think of being a pregnant. There is always a emotional and psychological aspect as well to look behind it.
Yep.
Like, are you prepared to be a mother? Are you career wise settled to accept a new life?
Yep.
And will see, if somebody pushes you to be a pregnant and you get a baby and then psychologically you don't accept that what is happening to your life is stuck, you are a career oriented woman and your life is stuck, then it makes a guilt in your life, which is not acceptable actually.
Yep.
So when it yeah, so ideally when you ask to target of your age, it can be mid of 30s where you can, up to that, you can naturally have a normal babies.
Yep. So mid 30s, there is most likely, look, these things that we're discussing here today, right? It may not apply to everyone. So we're just having a general conversation. Obviously, every single person, their health factors, they can vary. They're different. Person to person, they're different and they can vary. And if you have a special or specific condition, then you obviously have to see and work with your doctor. You have to see a doctor and work with your doctor. But these questions over here, they're very general today.
Yeah.
Yep. So because we have seen women who get pregnant when they're 45, we've also seen situations when in their 50s women have fallen pregnant. So
there's
again, yes, sorry.
there's always an exceptional. We are talking about general people, and there are every conditions. Like, you can find women easily getting pregnant at 45. Yeah, women's easily getting pregnant at 50s. There are possibilities. I mean, like, but these possibilities are very less in population to other than to a common studies which has been accepted
Yep.
overall the world. So of course, as I said, we have medically, we think that this is the ideal age of
Yes.
from 20s to mid of 30s, where you can normally have your babies without visiting a doctor or without being in an IVF. But yes,
Yes.
possibility after that makes increases, that you have to may attend an IVF clinic later on. But then yes, it's possible that you can get pregnant even after that.
Yep. I'm going to ask you a question. I just started, just randomly it came to me. When menopause starts, right? Can you conceive a baby when menopause starts? Because menopause, it lasts for a few years, right?
No, see, menopause is a condition which your body is shown you that now you don't have those hormones which is regulating your eggs, or your eggs or follicles will grow. So after menopause, it's highly impossible to have a baby,
Okay.
because you
Yep.
will not have hormones, you will not have eggs. Menopause is the condition of your body to show you now you are reproductively inactive.
Yes. But that doesn't mean that you're buddhi. You can always be Javan and
No,
young at heart. Always remember that because women, they freak out.
no,
They think that just because they can't give birth, it's not true. You're only young you
no.
as you think you are. Okay.
Your
Um,
only part of being reproductive stops.
that
Other
is
than you
correct.
breathe, you eat, you enjoy, that is all
You
what it
enjoy
is
your
as
life,
usual.
absolutely. You still dream of all the other blessings. You still can achieve so many other things in life. At what age did you have
Yes.
your kids? I'm just curious, just off the topic.
23 around, and later on, I guess, maybe after 3 years, 24, 26, 27.
Nice, very nice. And okay, one thing that I wanted to ask is before we get into IVF and the procedure and how it all works, just naturally, right? If someone wants to have a baby, what are some factors that can actually affect the probability? So let's say, what should women be looking after? I'm sure that I'm such a big advocate of health and fitness, so I'm sure that it always have some sort of part to play. So what would you suggest? What are those factors that we should actually be looking into?
See, age is the factor which we discussed previously. Other
Yes.
than, there are the lifestyle factors like smoking, which will affect your cervix and fallopian tube, which is anatomically important for your ability to conceive. Second
Okay.
is second is alcohol, and third is having an unprotected sex with multiple partners, which will lead you to sexually transmitted diseases like chlamydia and gonorrhea. So these
Yes.
are the factors, like overweight, less
Overweight.
weight.
Yes. Yeah. Yeah.
These,
Yeah.
yeah, this these two conditions. Even the less weight, I mean, like very less underweight, will also lead you to infertility. So
Okay.
stress is one of the most important factor. As an IVF, I'm telling you, major of the cases of IVF gets resolved if you let that lady out of the stress of not being pregnant. Because
Okay.
yeah, because what happens is like they are so pressurized from families, surroundings, that they have to have baby, and when they start conceiving, they are very impatient. They want baby very quickly, and when they see that okay, they are getting menses every month, they get stressed out. Okay, there is something happened to my body and I'm not able to pregnant,
Yeah.
and that stress leads to a lot of hormonal imbalances in them. So stress plays a major role, in the IVF clinic. I personally believe that if you take the stress out, you can probability increase chances of being pregnant very early.
Yeah. Yeah. I
So
also
there are
believe.
certain these
Yeah.
kinds of things.
Yeah. And diet also, do you think diet plays an important role, like your what you're eating and putting in your body and exercise?
Yes, it does play a very important role. See, we to be a mother, I mean, to be a pregnant, you just need two things. That is an anatomy to be very clear, and hormones.
Yeah,
We are made of chemicals. So
absolutely.
like once you exclude, yeah, so once you exclude the anatomy, entire other things like exercise, diet, your lifestyle, that all affects your hormones, all
Yes.
affects your chemicals in your body. So when you have a diet like sedentary life, when you are not having a proper diet, where you are having all the radicals, toxic radicals in your body, definitely it affects your chemicals, and every action has its equal reaction. Once you start not taking care of your body throws back to you of not being good to what you want to have.
That is so true.
So yes, it plays a major role.
Yes. And I also believe, especially coming from the same background as competing, not in bodybuilding, but in powerlifting, that if your diet is not good, if you're not exercising, if you're not sleeping on time, if you're not taking supplements on time, that also contributes to stress levels. And
Yes.
stress results in infertility. It results, can be one of the factors. It also just like weight gain. It also results in weight gain, weight loss, just being unhealthy. So look after your stress levels. I cannot stress enough. Now, um, what I wanted to ask next is that if someone, and especially over here in Australia, what doctors do is that even teenager girls, right, they'll put them on birth control. And some of these girls, they'll be on birth control, let's say for 10, 15 years. So they start taking it from like,
Yeah.
teenage, and then they stop having birth control when they're ready to have a baby, let's say from teenage to early 30s, right? And now they're ready
Yeah.
to be pregnant. So, do you think being on birth control for so long and trying to stop that natural process, once they come off it, does it make it more difficult for them to fall pregnant?
No, actually, it doesn't. It doesn't
Oh,
affect the fertility.
okay.
It doesn't affect But then, yes, when it comes to menses, resuming back to your menses, there
Yes.
are different stories. When it comes to fertility, doesn't affect the fertility of a woman. But then when it comes to menses, it takes a couple of months for your body to produce those hormones back. And so it will take couple of months to regularize. But some of the female may have irregular periods. Some may start with heavy flow, some may start
Yes.
with slow flow,
Yep.
but ultimately it comes back on track after a couple of months.
Okay. So periods is related to the whole pregnancy and everything, right? So healthy period means healthy uterus, and healthy uterus means that the chances of you getting pregnant are higher. So let's say if someone
Yeah.
stopped birth control, right? And they stop birth control, and if their periods, let's say, take 6 months to come into, like, it takes 6 months for them to be balanced,
Yeah.
then they'll be able to fall pregnant, right? Everything needs
Yeah.
to be balanced
Maybe
first.
not
Yes.
even 6 months, 3 to 4
Even
3
before
months is
that.
enough, I guess, for your
Okay.
back.
Okay.
Yes.
Yeah. Um, okay. Let's talk about IVF. I want to talk about IVF, right? So, at what age? So, freezing eggs, do you think this is considered IVF? Freezing your eggs? Is it part of the IVF process? What's the IVF process? Can you just
Yes.
explain? Yes. What is the IVF process?
Yes. IVF is in vitro fertilization where one cannot have natural pregnancy, so they go with the other steps other than being a natural pregnancy where you have multiple options,
Okay.
where you depends on case to case which will be best for which one. Like
Okay.
in utero semialization is one in that where you have uterus and you process the semen outside the body and then you inject with an injection in the uterus to increase the chances of being a pregnant.
Yes.
This we use when there is a low sperm count, when there is a kind of anatomical obstruction of to the cervix of a mother. I mean, like of a lady. Or second thing is, there is a chance of like mother they cannot have sexual activity normally and still they want to have baby.
Yes.
There are few women who can't have sexual activities normally like others. So for these kinds of women who are eager to have babies, they plan for IUI. IVF, then second is like in vitro, where you take the sperm and you take the ovum of a mother.
Yes.
You make a embryo, you take it in outside in a test tube, and then when the embryo is formed, then you implant into the mother's uterus.
Yeah.
That's another way. Third is ICSI, when the male partner has a very low sperm count, and
Okay.
at that time we take one of the sperm and we inject into the ovum of a mother lady so that she can, ovulate and get pregnant. So
Yeah.
there are multiple of these kinds of things which are
Yeah.
used.
And all of them, they will. So the which one of these we decide based on that particular person's situation. Is that correct?
Yes, we based on that based on the anatomical stuff of the patient, hormonal levels of the patient, and both the partners.
Yeah.
So it depends on both these factors.
Yeah. Now, at what age should we actually think of start freezing? Like women should actually be thinking of start freezing their eggs. At what age? What would be the ideal age?
Ideal is as such it is not there, but then before 36, it is recommended to freeze your eggs because those are the most viable eggs you can find, and multiple eggs you can find because after that it starts declining in the quality and quantity as well.
Yeah.
So after 36, yes, you can. Before 36, any age you can consider to have your eggs freezed.
Yeah. So the whole egg freezing process, is it painful? Is it a lengthy process? What is involved in that process to freeze eggs?
Okay, freezing egg process is like around 2 to 3 weeks. That also depends on clinic to clinic,
Okay.
and it is not a painful process. What ideally we do is we take we for first 10 to 12 days, we put women in a hormonal stimulation. That's the first step what we do. In hormonal stimulation, we give a self-administration injections to a patient has been taught how to take it. They
Okay.
take these hormonal injections.
Yeah, what
We
sort of hormone is that?
Yeah, these are the estrogen progesterone hormones which
Okay.
we give
Yeah.
to a lady to stop the normal stimulation, natural stimulation of the eggs.
Okay.
And we give the stimulation from outside so that we have a multiple eggs getting matured. After this process, there is a collection process, where we start. The doctor asks you to come, and this stimulation process you
Okay,
can do
I'm
your
so sorry.
natural activities. That's
Dr. Maya, I'm so sorry to
yeah,
cut you off. I just want to understand this. This is for me as well, right? So going one step
yeah,
back, once we get those
yeah,
hormonal injections, right? What does it actually do to the egg?
yeah.
What does it do to the egg? Why do we take those
See,
hormonal
normally
injections?
what? Yes. Now, what happens is like when you have a natural cycle going on,
Yes.
either each left side or right side of ovary will have egg maturation.
Okay.
Each one at a month, like either it's left side or right side of your ovary, which will mature egg. Now, when it goes naturally, you will have only 2 to 3 eggs, which will get mature naturally. But now,
Yes.
when you come for a freezing process, 2 or 3 is not enough for us to freeze.
Got
So
it.
what we do is we need multiple eggs to get
Mature.
mature. Yeah.
Yes.
So what we do is when you are naturally when you are on a natural menses, the amount of your hormones is less produced by your body, so that only 2 to 3 eggs will mature. But when you come on a hormonal stimulation, when you come on the injection, that will give you large amount of
I got
hormones
it.
in your body.
Yes.
So multiple eggs will mature. So the
I got
doctor
it.
has an advantage of preserving 6 to 12 eggs at a time.
Got it. Okay.
So yeah. So during this 10 to 12 days of your injection, you can have your all natural activities. Then after that, when there is a maturation, you're being called, and what doctors does is we put a needle from the vagina
Yes.
by the ultrasound guiding probe, and through
Yes.
this needle we aspirate the eggs from the ovary,
Okay.
and that is under light sedation or general anesthesia, so that doesn't give a pain to a patient.
Okay.
So it's actually a painless one.
Okay.
And on that particular day, you just have to rest just because you've done a procedure.
Yes.
And after that, the third step comes the freezing of the egg. That is called cryopreservation.
Yes.
In that, what we do is we freeze the eggs so that the excess of fluid, which gives you a crystallization in your egg, is prevented and stored for years and years then.
How many years
So
can we
this is
store
how
the
all
eggs
it
for?
goes.
How many years can we store the eggs for?
5 to 10 years.
5 to 10 years. Wow, that is so good. That is so good. That is amazing. Now, this is a stupid question, but again, it just came to my mind. When you extract the egg from an ovary, can you actually see it like with naked eye?
No, no,
You
it's not
can't.
seen.
It's not like anda. It's not like a proper egg that's given by a chicken.
No, this all is done under this all is done under microscope.
Yes. Okay.
Yes.
Okay, I'm just so curious to now I'm just going to be doing like now that I'm understanding the whole process, right? I'll be doing my research and looking up. I want to see how it actually looks, how an egg actually looks. Okay. Now this is preserved. Now after it's been preserved, then we'll discuss the next steps. But this process alone, right? How much does it cost here in Australia?
It depends on the clinic which you're accepting, but then it ranges from 5,000 to 8,000 normally.
Okay.
Some does in 4,000, some does in 6,000. Depends on which hospital you're preferring.
Yeah. And does storing cost you more, or all of this is included in the initial cost?
No,
Storing your
everything is
eggs.
included. Everything is included in that.
Oh wow, this is actually really worth it. It is really worth it. Now I'm just thinking, look, I'm not that person who's like, mujhe apni aulad chahiye. Like, I'm not one of those people who wants to, like, I'm not that egotistic, right? I'm not saying
Yeah.
that if someone wants to have their kids, they are egotistic. No, but I'll be happy to adopt. But if I can have my own, maybe I should look into this. I'm 33, so I have
Yes,
like 2 years.
as a personally, as a doctor, when I find a couple who are not capable of producing their own child, I always take a time to counsel them for adoption, because that also is one of the way of being a mother and father, you know.
Absolutely.
So
Absolutely.
yes, yeah,
To be honest, I'm like dead sure that one of my child is definitely going to be adopted, 100%. So
that's
yeah,
sweet.
yeah. I think I have the love to give, and I'll be able to accept and everything as long as my baby is not stressing me out. You just need to, yes, mommy, yes, mommy. Okay. Now, so we've discussed the cost and we've also discussed the process. Now, we've frozen the eggs. Now, let's say
Yeah.
when someone's ready
Mm.
to give birth, right? Then
Yeah.
what is the success rate? What's the success rate? What happens next?
See, when the success rate depends, like, you know, if you are processing, it depends on the eggs, how much you have matured and how much numbers of it. So when it is initially, you do it like, you know, more 3 or 4 years, it is more probability of you to get those eggs getting matured easily. And but then if you preserve it for a long time, and then when you rewarm it, the chances, of course,
Yes,
declines.
absolutely. Yeah. What I'm saying is that let's say if someone's ready in the next 2, 3 years, right? They come to you
Yeah.
and then there's more chances. Like, can you say that there's 100%
Yes.
chance of someone falling pregnant by IVF?
See, uh, chances is always a probability.
Okay.
So yes, definitely, if you come earlier, if you use those eggs earlier, the success rate is more.
Okay. Perfect. Now, can I ask you some period related questions?
Yeah, please.
And one question I think you've answered already, but I'll just touch on this. So, one of the followers asked this question that chances to conceive naturally with low sperm count. So, looks like she doesn't want to go through the whole IVF process. She's based in Pakistan and
Okay.
she's not very confident with the whole IVF process and preservation of eggs and everything in Pakistan. So, she's asked that the husband has a low sperm count and if they
Hmm.
can't go through the IVF process, what is the she hasn't given me her age, that's the thing. So it really depends at like what her age is and what other factors are. Now that we've gone through
Yeah.
all the details, yeah, okay.
See, when a normal couple comes, when they wants to be a parent, we normally give them 1 year of natural pregnancy. But
Okay,
when somebody is with low count, we give them
yes,
the large margin of 2 years to try it. You have to try it for 2 years naturally, and after that, if you can't conceive, then only you need to go. Normally what happens is, as you said, she's from Pakistan, like from India, Pakistan, these kinds of countries where we are child bounded always, we don't give much of time period to these couples, you know, to
that
conceive.
is so
They are always
true.
under, yeah. So they are always under pressure of being pregnant, to become pregnant, become pregnant. So if she is listening, I will tell that, you know, she has to go naturally 2 years to take care of that she becomes pregnant naturally. After 2 years, even after 2 years, she doesn't want to go with IVF. There are other factors which she can help her husband's sperm count to increase. It is not that once her husband has a low sperm count will be always low. There
Okay,
are always chances you increase by a good diet, multivitamins, type of profession. Like, you know, there
getting
are
rid of the
a lot of
mother-in-law.
that can't be possible. So, so then it would be in my first priority. That option would be first.
Oh my God, that's hilarious. All these mother-in-laws are going to hate me now. Get rid of
No.
Mariam. Yeah, sorry to
Even
cut you
me,
off.
my in-law might block me tonight. So
Yes,
so now what happens is with this low sperm count, we have done a lot of research. When you start with the multivitamins and minerals, like multi minerals for these male, they
yes.
start increasing their counts.
Okay,
He has to stop smoking, he has to stop alcohol, and have a nutritious diet. These
okay.
3 4 factors have shown tremendous good results in people with low volume of sperms after 2 to 3 months. Let me make it very short. 2 to 3 months of that these kinds of treatment where they take multivitamins, they quit smoking, they quit alcohol. Many male patients increases their sperm count. Now, what happens is normally when we say multivitamins, some of the patients take it for 10 15 days. They go, they do their sperm count, and they come and say, "Arey, isse koi farak nahi pad raha hai." But that
True.
doesn't happen. You have to give a time, take 1 to 2 months for him during the process when they are planning. They have to take multivitamins. They have to exclude all these factors. Even one more factor is there, the professional wise. If his husband is working in the environment which is very warm, like a hot temperature environment, then that also,
Mm,
even if a husband has a normal low sperm count, that reduces temporary professional wise because of this, because the
wow.
sperm to get produced requires a low temperature to get produced and a good nutritious diet. So if, like if you are a truck driver, you're working in the mines, you're working in the iron factories where there are a lot of fireworks going on, then definitely male gets affected by the low sperm count.
Wow.
So, yeah. So these are the things, because when a truck driver is driving, he's continuously he's sitting, the temperature is always warm, and
Yes.
that also affects the person's sperm count. So she
Wow.
has to get rid of multiple things so that there are always chances the sperm count naturally increases.
Yes. So first of all, try it. And then if that doesn't work, then you always have this IVF process. We live in a time or in a world where we have this option. If you go
Yes.
back a few years back, we didn't even have that option. So we're just so lucky that we have these alternatives. Wow.
Yes.
Okay. So we have discussed that. One other question that my friend actually asked me. She said to me that she gets this is period related question, and let me tell you, period is my favorite topic. On my Instagram, 5 days before my period, I post, guys, I'm counting my days, 5 days, because I go absolutely crazy. 5 days before my period, I feel like I'm possessed by an evil spirit. This is before. And then I keep
Yeah.
counting every single day, and every single fight or dramatic whatever is happening, all the drama in my life, dramatic situation, I blame it to my periods. This is because of my periods, guys. This is not me. I'm possessed by an evil spirit. Then my period starts, and then I'm dealing with the pain. Now, so many people actually have mentioned to me, because I go through extreme pain. I remember that my last cycle, I ended up having in a time period of 6 hours, I ended up having 8 Panadols, and everyone was like, "Mariam, this is actually not normal. This kind of pain is not normal." Do you
Yeah.
think every like normal period you shouldn't actually be experiencing pain?
See, it depends on patients to patient and the pain
Okay.
threshold you can take to. But yes, if you need to take multiple tablets, that's really not a good pain. You need to consult to a doctor and
Yeah.
have a painkiller, because no woman is allowed to have pain for no reasons. So
Yeah.
definitely you have a right to be a pain free, and it depends anatomically as well. Sometimes what happens is our uterus, many of the women doesn't know about this. As
Okay.
the blood flow down, and we
Yes.
have to fallopian tube as well. So the
Hmm.
fallopian tubes are also open for the ovaries to catch up.
Yes. Yeah.
So sometimes there is a retrograde flow of your blood, and then that spills into your abdomen. Those blood particles of your endometrium spills into the abdominal cavity, and then they get deposited onto the nearby structure. Now, when they get deposited, whenever next time you have a period, they start growing because they are getting those hormones, estrogen, progesterone. As your endometrium is getting, those cells are also getting hormones, and they start increasing. So that leads to a lot of pain, and that is called endometriosis,
Oh, this is what
which is very
endometriosis is.
common.
Okay.
But
Yeah.
yes, so there is a retrograde opposite direction flow of your blood flow into the abdomen, and
Hmm.
that blood doesn't have escape. So
Okay.
that
Wow.
is the thing which you have to check if you have a lot of pain during your menses. Once you have to get checked to the endometriosis, that maybe that is the reason you're getting so much of pain, you know, because
Yeah.
normal pain is okay. Yeah.
It's definitely, mine is definitely not normal. And trust me, okay, maybe I am a little bit of a drama queen, but not so much. I have a very high threshold to take pain, except for my period pain. This is one thing that I can't deal with. Give me 1 second. Gucci,
Yeah,
Gucci, no, chalo yahan se. Sorry, it was just my cat. Okay,
that's all
now
fine.
just one last question. And this is about my friend actually asked me this question again, period related question, that she only gets her periods. She's 34. She gets her periods 3 to 4 times a year. And she wanted me to ask you, is it normal that I get my period only 3 to 4 times? Plus, this friend of mine has gone through a lot of miscarriages as well. So I'd love
Okay.
to have your thoughts on this.
Okay. Now, first of all, she is 35 years old.
Yes, close to. Yeah, 34, yes.
34.
But yeah, but she
And
mentioned that she always had her periods only 3 to 4 times a year, even when she was
okay.
younger.
Uh,
Yes,
okay. See, ideally, let me explain you the journey of how it starts and how it eases off.
sure.
Normally, when you are 12 to 13 years old, you're about to get your start with your menarche, that is your menses. After that, you have to give 3 to 4 years to your body to get it regularized. It's always in the mind of parents that if you have a female child and she starts with menses, it has to be regular. Like अभी menses start हो गए हैं तो हर महीने आने चाहिए. That is a
Yes,
concept of most of the parents.
yes,
And what they do is if once you start with the menses and you don't get it for 3 4 months, you are taken to a doctor by your parents saying she's not getting regular periods, and then they put them on the birth control pills to regulate the cycle. But ideally, this is not a right way. You have to give 3 to 4 years to your body to, uh, you know, regularize naturally.
yeah,
Till then, no medications. Till then,
sure,
absolutely no medication.
sure.
After that, you once it sets, you are in a reproductive age. After that, what happens? There are two categories of women. One goes menopausal after 45,
Hmm,
but one goes menopausal after 30. That is called premature ovarian failure.
hmm,
But that comes after 30.
hmm,
So the one with these premature ovarian failures might have a family history of someone of their family might be easing off the menses very early, like her mother, her aunt, or anything from a paternal or maternal one, which
hmm.
is genetically got from them. Now, if your friend who is getting periods every 3 to 4 months, so initially also she had this poor access of pituitary and her hormonal access, where she could not link every month hormones for these periods. In a reproductive age, she might have gone with a PCOD, that is POS, polycystic ovarian disease, where you have less number of cycles per year.
Oh, okay.
Yeah, so she might have not treated. And now what happens is when you have a PCOD, you have a chances of miscarriages. You
Okay.
know, because you are lacking the hormones in your body. Now, if I am a pregnant, if she becomes pregnant, after that, the pregnancy needs progesterone hormone,
Okay.
which she is lacking. She is lacking
Yes.
because her body is showing because she doesn't have menses. So her body has reflected that she doesn't have um, proper hormones. So once she becomes pregnant, she's lacking the hormones already, and on that whenever her cycle was regular, whatever 3 or 4 months, at that time she had a proper amount of progesterone in her body. But the time when she was not having period showed that she did not had proper amount of hormones. So she gets pregnant at the time when she has a normal hormones. After that, a phase come when her hormones are lacking. Now, when the hormone is lacking, there is a miscarriage. So at this time, what we have to do is we have to inject the hormones from outside to protect that pregnancy for 9 months. And now what has happened with her in her case, repetitively she has been in lack of hormones. So her body has adopted to that withdrawal survival of without hormones. So she
Hmm.
is more in towards now. She will be having her menopause very early
Hmm.
because her body with the long years of journey has adopted to live without hormones, which we normally do after 45s, where which we
Hmm.
call as a transitional menopause, which
Yes.
takes around 5 years for you to enter the journey of menopause. So for her, she has been stimulated by her body mechanism far before.
Hmm.
So she will enter in her menopause very early.
Yeah. And don't stress. It's okay. You already
Yeah.
have a baby, so don't stress about that. I'm just telling her that it's got nothing to stress about. We're all different people. We're all different, and
Yeah.
if you lack in something, I might lack in something else. So it doesn't mean कि कोई कमी है. It just
No, 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 no.
means,
That is
yeah,
absolutely a body. Yeah,
yes,
we have a different body mechanisms. Every person, like we always as a doctor,
yes,
uh, it's a major problem. Everybody comes and says, हमारे रिलेटिव में ऐसा हुआ, हमारे रिलेटिव में वैसा हुआ, इसके साथ ऐसा हुआ, उसके साथ. And we are always have to be deaf on this part because we know
yes,
every human is different. So
absolutely.
what she has done in her body, it's her body. अगर वही
Absolutely.
चीज मेरे साथ हो तो शायद मैं एडजस्ट नहीं कर पाऊँ.
That is
My
so
body
true.
might not adjust.
That is
उनकी
true.
body वो adjust कर सकती है because she is accepting that naturally. Her body is accepting that naturally. अगर वही चीज हम किसी और के साथ बोले तो वो नहीं पॉसिबल होगी. वो
Yeah,
हर एक it's not in her. उनमें कोई कमी नहीं है. वो
बिल्कुल,
ये है कि उनकी बॉडी डिफरेंट है
बिल्कुल. I
इसलिए.
agree.
Yeah.
Now, I want to thank you so much, Dr. Maya, for all your, for sharing all of this information and your insight on this. And inshallah, we'll definitely have you over again.
Inshallah.
I want to end this with you saying something positive, like, I know that there is a biological clock. It is the reality. It is the reality, it is the reality of life. And we cannot control everything, right? But at the same time, I still want women to not put that kind of pressure that, look, because I see so many friends, they're turning 34, 35, they're in their mid 30s, and they're stressing and they're making all the wrong decisions and ending up with the wrong people. And just because they think that there is this biological clock that is ticking and there's this pressure, how do we deal with this pressure? I personally don't, but I just want you to say something so that they don't make that wrong decision.
Okay. First of all, as I said, there is a biological clock. We all know. Second thing is, after mid 30s, we have chances of pregnancy. The thing is, when we say there is a less chance, we mean that it's declining very slowly year by year. We are
Yes,
not, it's not a switch like we on Kia, off Kia. There is always a possibility that you're pregnant. There is always a chance you get pregnant after your 30s. Importance is not getting baby. Important is you physically and mentally accepting that now you want a baby. That is important. We have seen many patients in 20s who carries their baby and then they regret lifelong having a baby because they could not achieve what they wanted in their life, what they are made for, what their potentials were. Because you might be dealing with some relatives, but we are dealing day and night with kind of people with the same scenario. So it is not important to have baby. It is important that you are financially stable to have baby, you are mentally accepting that you're strong to take care of a new life, and you are prepared to give a better surrounding to a baby, that is important. See, if you are being forced by something, it will be for lifelong like a forced. So when it is accepted by heart, every little thing you do it by heart. It doesn't make that you are at 34 and you don't have baby. It doesn't matter. It matters that at age of 34, that now you have decided you can plan for your baby.
Absolutely.
When you will try for 1 year, you have 60% chances that you get your baby. After 1 year, then is the time when you should have a stress. Okay, now I have to go and face a rude doctor like me and
Yes.
have to take a torture from her.
Yes.
Till then, no, I will really not say that you have to stress that after 30 you should have your baby. That's very important for
Yeah.
you as a doctor and as a mother. I'm telling you, having a baby is not important, and your age is not always a factor that you will not have a baby. That is very a myth now. We are in a very different era where we have multiple things to help you guys to have baby even at 30, even at 40s, even at 45. Still your menses are running. Till we can find one egg in you, you can get pregnant from a doctor.
That is true. That
So
is so
that
true.
is not important.
That is so
So
true.
yes, so we just need one sperm and one egg from you to give you a baby.
That is
So
so
you
true.
have a lot of time. You
That
have a
is
lot
so
of time
true.
to focus on your career. You have a lot of time to focus on what you are made for, what
Yes.
your dreams are,
Absolutely.
and that is what is important.
Yeah.
See, if as a doctor, if I say you, okay, you have to get pregnant before 30.
Yeah.
Now, if you are not financially stable, or you find that this is not a dream I am born for, you will never accept that baby. You will always be in a regret and a guilt.
And I
So
see that all the time.
after 30, yes, so after 30, it is not that you will not get your baby. You will get your baby till you're 40. Yes, for 1 year you have to try, and after that you have all possible try
Yeah.
possibilities to get baby
Yeah.
until unless you become menopause. After menopause, I will not bet you that you will get pregnant,
Yeah.
whatever you tell me.
Yeah.
But before
And
before
and look,
menopause,
even if
yes,
you've
you
hit
all have
menopause,
chances
yeah.
of being menopause.
And let's say even if you've hit menopause, it's not the end of the world, guys. This is what I keep telling people. Don't put that kind of pressure on yourself. There are so many kids
No,
out there that you can adopt. You can adopt
yes,
animals. Look at me, I'm already a mummy of two kittens. So there are so many other options. Don't block your don't limit your options. Don't limit your options. And if you want to be a mom, you'll figure out a way to be a mom, but don't stress yourself out. Don't put yourself down. Be accepting of yourself. Just because, let's say, for some reason, even if you can't conceive and you can't adopt, and let's say if you don't like pets, it's still okay. It's not the end of the world. Don't feel that, I'm incomplete. Don't feel incomplete. There are so many other blessings in our life that we need to be grateful for. Alhamdulillah, we have so many other blessings. So be positive.
these all are part and parcels of life, but the most
Absolutely.
important thing is we are alive and we are breathing. That is more
Absolutely.
important. So
Absolutely.
you finding your own self is important other than running behind a tag of being a mother, or having a baby. Because
Absolutely.
there are many options. There are many options which you can accept for your happiness of being a mother. So before that, don't take it as a tag of being an incomplete. Okay, I don't have a baby and I'm incomplete. No, it's not that. You've come here not only to reproduce life. You come here to live a
Absolutely.
life.
That is
Yeah.
so true. And just on this is, I promise this is the last example that I'm giving. I recently met someone, amazing person, very educated, she's got a career, everything. And she was just asking me, we were just having a chat, right? And this is the first time I'm meeting this person. And she asked me, as in, what do I do? And I was telling her about the podcast, and I mentioned your name. And then she's like, Mariam, this is such a great topic that you're doing, because I rushed, and I am actually in a bad marriage, and I'm not happy, only because I put that kind of pressure on myself, that I am running late, about that whole biological clock, right? And now she's in a marriage, and she is staying with that person. Again, this is a different topic, but what I'm saying is,
Yeah.
when you put that kind of stress and pressure on yourself, you end up in these situations where you're not happy. At the end of the day, you need to be happy within you. If you can't
Yeah.
find happiness within you, you'll never be happy. Whether you're a mom, whether you find a man, whether you're married, whatever, all of these things are secondary. The first thing that you need to do is find happiness within. Got it? Perfect. All right. Thank you so much, Dr. Maya, for joining me. I really, really, really appreciate your time. I hope I haven't annoyed you
Yeah,
much.
absolutely. It was my pleasure, and to inform people, knowledge is always better to share with the people. It helps a lot of people to sleep with a normal sense of being relieved with a lot of questions they have in their mind about their life and what they need to do. So I'm always
Absolutely.
happy to share it. If you have a lot of today might be all of your friends who have these questions in mind might be restless with these kinds of questions. So today they have got the answers to it, that okay, they have to think about themselves first other than running behind attack of being mother. So
Absolutely.
yeah, that gives me a pleasure to be here.
Thank you so much. Inshallah, we'll definitely have you over again. And
Yeah.
you have to come. You have no choice, and you're not going to say no. But thank you so
Yes.
much again. I'll let you go
Yeah.
and enjoy the rest of your night.
Thank you so much. Yeah.
Thank you so much. Bye bye.
Yeah. Bye bye. Yeah.
Bye bye.